All right, it's 11:30, so we'll go ahead and get started. Thanks for being with us for our weekly COVID-19 media briefing. With us, as always, is District Health Officer in Washoe County, Kevin Dick. He'll do a quick opening remarks and open it up for questions. If you want to give a question through the chat panel, I'll read it out loud if that's what you need. So Kevin, if you're ready, please go ahead.
Yes, thank you, Scott, and thanks everybody for joining us. I want to wish you all a happy new year and let you know how happy I am that we're now in 2021 and moving forward with a vaccine that we're now dispensing. And the vaccine has received a lot of attention in the national news and discussion about the pace of the vaccine administration. And I can assure you that we are continuing to work hard here in Washoe County to dispense the vaccine and get it in people's arms. As I've said before, it doesn't do any good to have a vaccine. What's important is that people are vaccinated. That's what really prevents disease. And so we reported yesterday of the 5,500 doses that we had dispensed through the health district. That was beginning right through the holidays, starting on December 23rd was the first day that the health district administered the vaccine through our pod. We administered vaccine again yesterday to over 500 individuals. So we're at over 6,000 doses of the vaccine now that we've distributed. So close to 70% of the allocation that the health district has received. We are vaccinating through our pod again tomorrow, and then we'll be operating the pod on Saturday with capacity of 1,200 individuals to be scheduled through the pod then. So I'd like to also, though, let the public know that while we're moving the large numbers of people through our pod for vaccination, that that cannot be the only solution for our community. And we need to have others involved in dispensing the vaccine. Excuse me. So in the future, as more vaccine becomes available, the state plan is to include pharmacies in the allocation of that vaccine and for them to be involved in providing vaccinations to the 75 and older age group. But we are not yet to that point of that vaccine availability to dispense through the pharmacies. So the current state that we have is we only receive information of what vaccine we're going to be allocated from the federal government just within a few days before we receive that vaccine. So we have less than a week of clarity in front of us as to what vaccine is going to be available for us the following week. And what we've experienced to date is that there is less vaccine that's being allocated than what's requested. So I'm hopeful that moving forward, we'll have greater clarity from the federal government regarding the supply of vaccine that we'll be receiving, and that we'll also have more vaccine that we're receiving, which will allow us to allocate that vaccine more broadly through our community for it to be dispensed. In addition to the pharmacies providing vaccinations, we're really looking to other partners to assist with this effort. We need our doctor offices, our schools, our large employers, other medical providers to help in stepping up and administering vaccine to their employees, as well as others in the tier 2 age group and in that 75 plus population. So that's what we expect and hope for in the future as more vaccine becomes available. So if providers are interested in getting lined up to receive vaccine in the future, they should do so. If they don't have that information on how to work with the state, please email our COVID Washoe at washoecounty.us email, and we can get you in the loop for that process. For folks that are getting the vaccine, it's important for them to recognize that it's a 2-dose process. And so when you're scheduled for your first dose, or the day that you receive your first dose, it's important for you to block your calendar for the second dose. And when you receive your first dose, you'll be notified of whether it's Pfizer or whether it's Moderna, and you'll be provided with a card with that information. And it will also provide you the information of the day that you need to come back for your second vaccine, which will be 21 days after your first vaccine if you get the Pfizer, and 28 days later if you get the Moderna. So it's important to hang on to those dates so that you can come back and get the second vaccine on that date. We're working to provide the vaccine as quickly as possible to as many people as possible. And so it will slow down that process and prevent others from getting vaccinated if people are trying to adjust that schedule. And we may not be able to accommodate that. So it's very important to plan ahead and make those plans to be able to show up for the second dose of the vaccine on schedule. The other thing that is very important for everyone to do is to remain patient. I know there's a lot of people that are very eager to receive the vaccine. That's great that people want to get it. But we, as I mentioned, are still awaiting allocations from the federal government to be able to distribute that. And so we hopefully will get more soon, and we'll have it available more broadly through the community. But this is a process that's going to take a little bit of time. And we have never done anything to this scale before in our lifetimes. And so we are working diligently to have those plans in place to dispense. But as I mentioned, while there's been a lot of talk about the 75 and overpopulation receiving the vaccination, the allocation is not there for it to be available through our pharmacies for that dispensing at this point. We hope to move there soon. We are wrapping up with the healthcare frontline workers in the hospitals, our other healthcare providers, our first responders, our laboratories and pharmacists, our frontline public health, law enforcement, et cetera. And as we are working through the completion of Tier 1, and we have some availability in the scheduling through our pod, as we're concluding that, we have been given the green light to start scheduling some of the frontline school staff, so K through 12 staff, and we're going to be moving into including them here in the next few days. We're working with the school district, and we're working with the charter and private schools to identify these employees. So this will be occurring, and they will receive information through their employers. The other thing that I would ask is patience on when you get that vaccine based on the tier that you are placed in. The state has developed the tier structure based on guidance from the CDC, and they make the decision on who's in those tiers, and then we implement their game plan and provide those vaccinations to those tiers. So we have a lot of people that are contacting us and making the case that they should receive their vaccine now or in a different tier than they're assigned to. And it's not up to us to make that decision. it's made at the state level, and the state has provided a lot of consideration to how that is structured, and there's a reason for the way they've structured that. So I ask for people to be patient and allow us to continue moving forward with this process, get people vaccinated so that we can get to you and provide you with that vaccination when it's your turn. As far as our COVID-19 situation, the hospitalizations and cases are still lower than what we were seeing through December, but they remain at high levels. And we also have just moved through the Christmas and New Year's holidays. And so we anticipate that we will be seeing a surge coming out of gatherings as we've experienced in the past. And we'll be assessing over the next several weeks what the impact that has on us. Everyone has seen in the news the impacts that are occurring to the healthcare system in California, and also incredible strain occurring in Arizona, our neighboring states. And so we're quite concerned as well with what the surge that's happening in those states, what impacts that may have on us as well. So we'll be watching those numbers, but we are not out of the woods. I think it's important to recognize that we have made some progress with the governor's pause in reducing the number of cases that we have, but we need to be very cautious right now with both the holidays just right behind us and seeing what's happening in California and Arizona. Our deaths continue to rise, and we've eclipsed 500 cases earlier this week. So tragically, over 500 people killed by COVID-19 just since March here in Washoe County. So we need to continue to recognize this is a serious disease, and we need to continue to practice all of the precautionary measures that we've talked about, wearing a mask, watching your distance, washing your hands. And it's also important for everyone to recognize that as we are having people that receive the vaccination, it's important for everybody, vaccinated and unvaccinated, to continue to follow those practices. We do not have scientific data on the Moderna and the Pfizer vaccine yet to know whether people that are vaccinated can still carry the virus and transmit it even though they don't become sick. And so for that reason, as well as there's no easy way to know who's been vaccinated and who hasn't, we all need to continue wearing masks and following those practices in order to protect one another as we're moving through the vaccination process. And with that, I'll turn it over for questions, Scott.
All right. Thank you, Kevin. Any questions?
Hi, Kevin. Shuditi from This Is Reno. Thank you for the updates. I have a couple of questions, but I'll start with one. And if we have time later, maybe I can give you more. So my first question is about the vaccine allocation. You mentioned that it appears after listening to you that maybe the district gave a number to how many vaccine they need, and they haven't really gotten as many vaccine. Is that correct?
Yes. What's occurred for us to date is that we have received a smaller allocation than requested, and that's consistent, I think, for the state as well.
Could you give me a number, like how much was requested and you received?
I'm sure that we can provide that to you through Scott, but I don't have that number in front of me right now. I'm sorry.
Okay, yeah, thank you. And just one more question. So when you say that the state remains concerned that the impact from Arizona and California might be felt in Nevada, could you elaborate on that, please?
Well, we share borders with those states, and we have a tourism industry here. Our casinos have been open over the holidays, and so with the the numbers of cases that are occurring in those states. If we have people that are traveling here from those states, we have the potential for them to bring the COVID-19 here, additional cases, as well as if we have residents that are traveling to California or Arizona, they also have the potential for being exposed there and bringing it back.
Thank you.
Hi, Kevin. This is Siobhan from the RGJ. How's the contact tracing program with all the extra employees going with the school district? Is that set up and running now? Is it in full force? Are you still using like 40-something people, health district employees?
Well, we're continuing to utilize the existing disease investigators, those 40-some employees that you mentioned that we have at the health district. And we are training the additional county staff that are getting ramped up for the disease investigation contact tracing work. That will be the group that's focused on supporting the school district moving forward.
So that hasn't started. None of those employees have started yet?
They've started and they've received their initial training, and they're doing shadowing. And you don't just take a class and flip the switch and now you're out there and doing the job. We have them working with people that are doing disease investigations so they can get up to speed and understand more of the aspects around it, how to answer questions, how to make decisions with individual cases.
Are we ready to be open, or is the county ready for elementary schools to be open and in a couple of weeks for high school and middle schools to return to classrooms?
I think we're prepared at this point for the elementary schools, and we're working to expand that capacity and be able to support the middle and high schools in the future.
Hey, this is Lucia Starbuck from KUNR. Can you elaborate more? So Washoe County is moving on to tier 2 folks, including educators. Can you elaborate on that a little bit?
Yeah, so as I mentioned, as we're wrapping up with the tier 1 individuals, our scheduling is not full for some of our pod activities. So we received the green light, and we're working with K through 12 schools in Washoe County to identify individuals and have them get scheduled to be able to get vaccinated through our pod beginning this Saturday.
And sorry, just a few follow-ups. You're asking teachers to go to organize that with their administrators. And then also, I thought at a previous press conference, you said we wanted to hit 80% before moving on to tier 2. Is that no longer the case?
Based on our discussions with the state and with the response that we're receiving from the tier 1 workforce, they have agreed for us to move forward with tier 2. That said, if there are people that are remaining in that tier 1 workforce that have not responded to the information they've received from their employers and scheduled to get vaccinated, I would urge them to do that at this point. I'd also, like to say that this isn't going to be a perfect process, and if we're going to strive for perfection of getting everybody in exactly the right order and hitting all of the marks on the percentages in a tier, that's going to delay overall everybody getting vaccinated. So for instance, with the tier 1 vaccinations, some of the skilled nursing and long-term care facilities, most of them are being handled by CVS and Walgreens. And so if CVS and Walgreens are still working through that population based on their federal agreement to do that, it doesn't make any sense for us to stop our vaccination efforts and wait for them to get those other facilities done if we could be providing that vaccine. And so I guess the metaphor that I would use for this is boarding an airplane. And I think everybody has probably flown Southwest, and I'm trying to go very rigid with the tier structure as far as moving from one to the other, or even within the tiers, to be completely adherent to that would be like boarding a Southwest plane and you come to B-15 and that person is not lined up in line, and you stop boarding the plane until you can find B-15 somewhere in the airport and get them on the plane before you move on to B-16. A good chance your plane's never going to take off. So we need to have some flexibility and use some common sense as we move forward as well.
Thank you. I love the metaphor. And just a last question, I guess, are you concerned, as you said, that your scheduling isn't filling up, that the tier 1 folks aren't coming in to get vaccinated, as you guys thought maybe?
I have not yet seen a percentage of folks within tier 1 that opted to receive the vaccine. But I think that I would encourage people to take advantage of the opportunity to get the vaccine when it's available. And I know some of our first responders have had really good acceptance and vast majority getting the vaccine. I'm not sure if that's occurring throughout all of tier 1.
Just to follow up, how many teachers will be vaccinated on Saturday? You said there's a pod set up. How many vaccines do you have set aside for K through 12?
We have 1,200 set aside for the pod.
Okay.
But there could be other tier 1 providers that are getting vaccinated through that pod as well.
Hi, Kevin. This is Sam from AP. I know you said you don't have numbers on the number of people who are declining to get vaccinated, but have you heard reports from law enforcement departments, hospitals, assisted living facilities, or schools of people who are in tier 1 declining to get vaccinated? And if we ask Scott, could we get those numbers?
So I know that there are people in tier 1 that are declining to get vaccinated, but I don't believe that we have any solid numbers at this point, Sam. I think that's something that we can work toward as we get further along. I think the other piece to recognize is that the data entry following the vaccines is there's a lot of work involved with that in getting everything entered into the data systems and WebIZ for those vaccinations, and that's a lagging process. I think not just here in Nevada, but nationally. And so I think what we're able to do with the health district is understand how many doses that we received and how many we are estimating have been allocated through the pod. So we've got that measure. But even looking at the number of vaccines that we've received may not be an accurate number, because as we get the vials out and are putting the vaccine in syringes, everybody's seen the reports that we're getting. We may be getting 6 or 7 doses out of a 5 dose vial. So the numbers don't line up exactly. And it's until we get all that data entry done that we'll have the precise number. We were at the health district working through some technology glitches just as they ramped up the vaccine quite quickly. We were working with our electronic health record software platform, or I guess the cloud-based platform that we utilize for them to develop a COVID vaccination module and application to go with that. And so they developed it quite quickly, and we've been working with them. We were the first to test the implementation on it nationally. And so we've been working with them to work out some of the bugs. And one of the bugs was that it was not interfacing properly with WebIZ for our data to go into WebIZ. And we've been able to resolve that problem. And we're now working through that, but it resulted in us having several days of data backlog on getting our numbers into WebIZ. And I suspect those will be other problems like that occurring across the county and nationally as we're working as quickly as possible and developing our systems to be able to keep up with the data.
So given the data lag, how do you know how many vaccines to give to the pods for teachers, per Siobhan's question? And why are you telling us that the rollout is a success if you're not confident in the number of vaccines that have been administered?
Well, I'm confident in the number of vaccines that we've administered through our pod because we have, line of sight on that. As far as the number of vaccines that we're providing for the schools, we're not allocating a specific number for the schools, Sam. We're allocating a number that we can put shots in arms through our pod. And we have a mixture of people that are wrapping up tier 1 coming through at the same time that we're providing availability if there's scheduled slots available for people in education in tier 2 to begin getting vaccinated.
Thank you.
Hi, Shruti again. And this might be a silly question, but I feel like I need to ask this. So how are people being notified that they qualify for the vaccine?
So currently we're doing that through their employers. And so their employers will work with us to identify the number of employees that they have that need to receive the vaccine. And then we work through their employers to provide them with the process for how they can get scheduled through our pod to get vaccinated.
Mm-hmm. If my understand, yeah, sorry, please go on.
And the other piece would be, if it's their working at a hospital, if they're working as a first responder, et cetera. We have fire agencies and hospitals that are also involved in administering the vaccine, and they're working with their employees for the arrangements that they make for their internal pods, we call them.
Mm-hmm. And if my understanding is correct, I think the defense related companies, say for example, like Sierra Nevada Corporation, they might be qualified as well. Are companies like local companies like that also working with the county?
So they are included within tier 2, and we will notify them as we get to them of when their employees can be scheduled. But we are, very engaged in working to identify the employers that are included within the various categories that we'll work through in tier 2 and communicating with them so that they understand that they're in the tier and they can begin working to provide us with information about the number of employees that they have that would be the ones that should be receiving the vaccine so that we can start working that into our plans for rolling out.
Mm-hmm. And just one last question. So you mentioned that the county cannot vaccinate everybody on its own. The school and other companies, local businesses need to step up as well. So when you say that, what does it look like? What should these companies or schools do to make the vaccination drive a success?
So in order to get a vaccine allocated to them, they would need to have a physician that they're working with and get what's called a PIN, a physician identification number, that they could then get registered with the state and federal government to have a vaccine allocated to them. And then they would need to have people available, and many large employers already have some nursing support, et cetera, but they would need staff to be able to administer the vaccine. And they would also need to then provide that data entry into WebIZ regarding the people that they administered the vaccine to.
Thank you very much.
Kevin, to follow up on that, how many organizations, and has the school district done that? Do they have a doctor they're working with now? And if they were to get the vaccine, could start vaccinating people on their own?
The school district has not done that to date. So actually have a call with them this afternoon. And we're also trying to figure out what we can provide through the pod, what they could contribute toward that, et cetera.
But other organizations has any other big employer gone through that process yet?
I'm not aware that that they have. So far, I think it's been mostly our healthcare, our hospitals, some other providers, first responders that have been involved with getting signed up for that.
And nobody has done it on their own yet, though, in this first tier. They would just be eligible to do it in the second tier.
Yeah, most of these other entities that could participate in that role in the future have not been part of the tier structure yet.
Okay.
Kevin, we've got a question from Kenzie at Channel 4. Says, since schools were taking up a lot of the health district's resources, since the closure, have you guys been able to catch back up with some of the contact tracing? And is it a good idea for them to return on January 19th?
So we have caught up with some of the contact tracing, and but the other thing that we're doing is with the high numbers that we're still having, we're using the CDC guidance, as I've mentioned before, on how we prioritize the contact tracing. So the schools have been a priority and will continue to be, and the group that's getting trained up of county staff will help us with focusing on that group. But we're also working to develop more automated systems and for people to get the information and be able to do their own notification of contacts versus relying on somebody from the health district to be making contact with each case. The state has also streamlined the interview process and the information that we're collecting from the positive cases. And so that's helping us to be able to move through more of the cases more quickly. And as far as the school reopening, my understanding is that at this point, the school's plan is to reopen under the hybrid structure for the middle and high schools. And I think that that's a prudent approach at this point.
Did you get a vaccine, Kevin? This is Siobhan.
Yes, I did, Siobhan.
And how did it go?
It went well. You know, I had the standard, you know, hurt around the shot for a few days. My arm was a little sore, but I didn't get the rash or anything else. And then that soreness went away after a couple of days. But then I think I'm kind of an oddball case, maybe too, because it was about a week after that my arm started itching around where I had gotten the shot. And then the next day I had a rash on my red area on my shoulder, and it itched. It didn't hurt. And then that faded away after a day or so. So
did you just breathe a sigh of relief after getting the shot? Did you pop open a bottle of champagne? What happens?
Well, I did about a week later on New Year's. I popped open a bottle of champagne. But actually, I felt really good after getting the shot. Was relieved to have had it. You know, I think that from what I hear from others, I think my experience was somewhat typical. You know, most of the people just have a pain in their arm similar to getting other shots. Some people feel kind of fatigued and dragged down for a day or two. But you know, we haven't had any anaphylactic type severe reactions occur from people that have gotten the shot through our pods. We've had a few people that, you know, I think less than a handful that have had some rash type reactions that occurred quickly after getting the shot. But I think the most severe of those just took some Benadryl and were okay. So I think it's encouraging what we've seen so far with the vaccine and what I've heard in talking to fellow public health employees here that have received the vaccine.
Any other questions for Kevin Dick? Hear none. Thank you all for joining us. The recording will be on the COVID-19 website, COVID19washoe.com website soon. Have a great week, and we'll talk to you next week.